We're putting the spotlight on the ladies, and when it comes to period pain, it is the very normal part of the menstrual cycle, which most women experience at some point in their lives. It's usually felt as a painful muscle cramp in the tummy, which can spread to the back and thighs, along with a whole host of other possible discomforts. I know. Now we welcome back one of our regulars, gynecologist and obstetrician, Dr. Jason Bennett, who will be talking us through some of the symptoms of menstrual pain and how, most importantly, to treat it. Good morning.
Hi, morning.
Jason, I love that we get to unpack this, because I feel like for a lot of us, this might seem like common knowledge, but there's actually a lot of people that don't know or understand what causes menstrual pains.
Totally agree with you, Zoe. So menstrual pains are caused by a special chemical inside a woman's uterus called a prostaglandin. And it's released when a woman has her period, and this prostaglandin causes blood vessels and the muscles of the uterus to contract. And these contractions of the uterus are very painful, and it's what you experience as a painful period.
Now, besides the cramps, what are some of the other symptoms that you can experience, during menstrual pain? Like, let's unpack some of those symptoms.
So, yeah, there are a host of other symptoms not associated with painful periods. And it can start with headaches, you can have breakouts, breast tenderness, nausea and vomiting. A lot of women experience constipation and diarrhea and bloating around their periods.
Because I think a lot of us, experience one or two of the symptoms, perhaps a little bit more. How long does that discomfort usually last?
So we say about 48 to 72 hours is an acceptable time to experience some discomfort for your period. Any time longer is a little bit of a problem, and we need to address it.
Now, of course, that pain and that discomfort is never nice. It's never easy. It's very disruptive to your day-to-day goings. Now, how can we relieve some of that pain or some of the symptoms?
So there is definitely treatment and management. As we've chatted about before, it's always important to start with conservative measures. So doing a menstrual diary, so you can start to predict when you're going to be having a painful period or when your periods will be on the way. It's decreasing things like high carbohydrates in your diet, refined sugars, stopping smoking, decreasing alcohol, doing meditation, yoga, good aerobic exercise can really help with period pain. Simple analgesia, especially something like BRUFEN, can help a period pain dramatically. Then we can move on to other medications, so most of it is hormones. Something like the pill really can help someone with period pain. There are the injectables as well, injectable contraceptives, that we're not just using for contraception, but using them to help us with pain. There are special devices we can also insert into the uterus that release small amounts of hormones every day, and it can really dramatically decrease the amount of period pain that a woman will experience.
So there are lots of options. We do not have to suffer. And
no one must suffer.
No one must suffer. I like that. Now, Dr. Jason Bennett, I have one more question for you. I find that when I am on my period and I have a bowl of cereal, it's like the cramps just intensify. Has anyone else had something similar?
Well, I think everyone is different, and a lot of women have different triggers. It's something to identify and to kind of avoid during your period.
Well, Dr. Jason Bennett, thank you for joining us this morning.
Pleasure. Thanks for having me.
Being in pain at that time of the month, every month, doesn't have to be as bad and uncomfortable. BRUFEN can help relieve those menstrual cramps, the headaches, and the back and leg pain that time of the month. Targets pain caused by menstrual cramps. BRUFEN works where it hurts.